Lecture on the topic Syndromes and Diseases of the Cardiovascular System, diseases associated with these syndromes, early diagnosis, differential diagnosis, treatment, prevention, and rehabilitation. It is believed that problems with the heart and blood vessels are mainly an adult story. However, CVD is getting younger and children's cardiovascular diseases can disguise themselves as other diseases for a long time or not show up at all. Non-drug prevention in childhood is most promising when the stereotype of behavior was not yet developed. That is, there are no bad habits. Therefore, it is so important to identify pathologies and form the correct culture of child behavior in order to prevent serious consequences. Physiological features of the child's CVS. Heart in the shape of an oval. The heart has a large mass relative to the mass the entire body. Differentiation of the heart muscle structure. The structure of the heart muscle is loose, abundantly supplied with blood and lymph. The development of the innervation apparatus is coming to an end. Rapid and unstable pulse. The arteries are better developed than the veins. Well-developed capillary network. Heart disease in children. Congenital heart diseases are the most common pathology that occurs in young children. Inflammatory heart diseases in children develop against the background of the penetration of pathogenic microorganisms into the body. The infection leads to inflammation of the muscle, the inner and outer membranes of the heart. Arrhythmias occur in 25% of children. They often disappear as they grow. Risk of childhood heart disease. Malformations such as Fallot's tetrad, transition of the main vessels, etc. Sick children are either operated on or they soon die. Risk of childhood disease. Many congenital heart defects are rare. There is a hidden danger in yourself. When symptoms of heart failure appear at the age of 20-25, it is too late to perform surgery due to the very high operational risk. Thus, a person lives in the last few years as a severely disabled person and dies at younger age. Congenital heart disease forms in the embryo at 2-8 weeks of development. They occur in 3-4 out of 1,000 live births. CHD is divided into 3 groups, with the enrichment of the small circle of blood circulation, with impoverishment of the small circle of blood circulation, with impoverishment of a large circle of blood circulation. Defects with impoverishment of the small circulatory system. With such defects, the transition of blood from the right ventricity to the pulmonary artery difficult. This is an isolated stenosis of the pulmonary artery. Defects with impoverishment of a large circulatory system. Such malformations are characterized by the incorrect distribution of blood flow. Acquired biases. Acquired heart defects occur after diseases caused by group A beta hemolytic streptococcus. These are complications after a sore throat, exacerbation of chronic tonsillitis, scarlet fever, etc. The signs of CVD in children: slight weight gain during the period of active growth of a child, poor appetite, headache, general pallor, rapid fatigue, etc. Causes of CVD in a child: pathologies, injuries during childbirth, autoimmune diseases, hormonal failures, narrowing of the aorta. Risk factors: heredity, smoking, excess weight, etc. Complaints: the basic complaints are pain in the heart area, edema, cough, and additional ones are weakness, fatigue, sweating, headache. Thank you.